Hello, everyone. I'm your host, Andrea Weckerly, and welcome to the Ready Living podcast, where each episode is designed to educate, inspire, and empower you to create the life you want. Thanks for joining us, and remember to subscribe for free on your favorite platform. My guest today is Dr. Ken Gorczyca. He is a veterinarian, veterinary death doula, artist, and founder of A Beloved Farewell, a mobile, in-home, end-of-life care practice serving the San Francisco Bay Area. His work is devoted to transforming how we experience the final chapter of life with our animals, bringing together medical expertise, compassion, and presence. He integrates ritual, storytelling, and music into his end-of-life care, creating meaningful, personalized experiences that honor the human-animal bond and support families through grief with connection and love. He believes our animals aren't only companions, but profound teachers in how to live fully and let go with grace. Ken is also an educator in the University of Vermont Companion Animal End-of-Life Doula program, where he combines medicine and spirit, supporting both animals and the people who love them. Previously, he helped found Pets Are Wonderful Support in San Francisco, ensuring that individuals facing serious illness could keep and care for their beloved animal companions. He also helped found the Lesbian and Gay Veterinary Medical Association, now Pride VMC, reflecting his long-standing commitment to compassionate care, community, and advocacy within the veterinary profession. As an artist, Ken creates memorial portraits and heart songs that honor the spirit and story of each animal into lasting tributes. Welcome, Ken.
I'm really excited to be here.
I want to start out with defining what an animal death doula is.
We can maybe go back to what even doula means. That goes back to ancient Greece, where a birth doula or a midwife helped a woman give birth. There's also people that help friends and family and neighbors die. That became the death doula. During the AIDS pandemic, I got first introduced to this work. As for the animal world, in the last pandemic, COVID pandemic, Francesca Arnoldi at the University of Vermont had been creating the death doula course for humans. And she realized that there was also a need for helping people with the death of their animals. And so that's really where this modern companion animal end-of-life doula training program started around 2020.
So it's very new.
It's new in the sense in the modern world. In the ancient times, we knew about death and we knew about how to die. And so I think it's just that we're rediscovering this lost art form. And so let me just talk a little bit about the companion animal death doula. Theoretically, this is a non-medical person that is there as a companion and a guide to help the client with the loss of their animal companion and helps the animals as well. In the veterinary world, especially for many of us that now do in-home euthanasia, there's a whole new movement of professionals that's all we do. We go into people's homes to help release their animal companions. I'm a big believer that medicine and the veterinary practitioner and the death doula merge in that moment. Many of us are now taking this role on and trying to really make these experiences powerful.
In an interview, I heard you say that without realizing it, you were already acting as a kind of death doula in the 1980s when the AIDS crisis began, and that your path to becoming an animal death doula seemed like a logical extension of the work you were already doing as a veterinarian.
I graduated from veterinary school in 1983 and started working in San Francisco around that time. And it turns out I entered the dawn of the AIDS pandemic. And little did I know that this human illness would actually shape my veterinary career to a huge extent. A lot of my clients had AIDS. Over that next, I don't know how many years, 7 years, I lost at least 300 clients to AIDS and dozens of friends and colleagues. And so it really became a big part of who I am. I was guided to help in this crisis because a lot of physicians were telling their patients with AIDS and HIV to give up their animal companions for unknown fears. There's a lot of diseases called zoonotic diseases that animals can give to humans. We didn't even know where the virus was coming from. Being prudent, these physicians were telling their patients to give up their pets. And as a veterinarian, I knew that this was not really the best advice because animal companions are medicine. Sometimes all we have in our lives when our family members, our jobs, and everyone else doesn't want to be around us. And you can't tell someone to give up that. And so I got involved with the community. I helped found what's called Pets Are Wonderful Support, where we had a volunteer system where we help people take care of their pets, dog walking. We raised money for pet food, veterinary care. When people went in the hospital, we had foster care. It was a huge, successful volunteer program, and I'm really proud to say that it's still in existence today after 40-some years, and it's one of the few AIDS pandemic organizations that survived. People would go in to help animals, but it turns out they befriended people that were dying, and they became death doulas themselves. When I look back at my own experiences, I helped so many friends and clients the dying process. I didn't know the term death doula, but that's what we all were doing in San Francisco or around the country or the world.
You trained as a death doula through programs like the Companion Animal Euthanasia Training Academy and the University of Vermont's program that I mentioned in the introduction. What language or ethical framework did those programs give you that traditional veterinary education didn't?
Death doula programs go really deep into being companions. I just want to share what the tenets of doula care are. We accept that birth, death, and grief are normal. It's natural. It's expected part of life. We cultivate inner calm and peacefulness in this time. And we assist each client, helping them understand that this is just not a medical procedure, but it's really an end-of-life ritual. It's a sacred moment. We're companioning rather than treating the animals. At that point, there's no more treatment. We're serving rather than fixing. I started practicing in San Francisco in the 1980s, in the middle of the AIDS pandemic. I'm a gay man, and I ended up being infected with HIV. And so I was told I had a year or two to live, and here I am, privileged that I'm a long-term survivor. It's been some 43 years. During that process of being sick and having to retire from my practice at a very early age, I didn't give up. I continued to work in the community with Pets Are Wonderful Support. I created the Lesbian and Gay Veterinary Medical Association, helping to support my professional colleagues survive in a world that wasn't always accepting. The veterinary profession is now very open, but it took many decades. Over my time, I've been doing a lot of work with nature. I did work with Michael Harner in shamanic healing for 5 years, and so I really went deep into spirit. I found a group called the School of Lost Borders, which takes individuals out into the wilderness to do vision fast. And so I've been doing that as a way to heal, but also to try to find purpose. About 5 years ago, I went into Death Valley on one of these quests, trying to figure out what is my purpose. It became very clear out there in nature that death was on my shoulder, that was really who I was. And so when I came out of that retreat, I started Googling death and dying in the veterinary profession. And that's where I found the University of Vermont course. I found the Companion Animal Euthanasia Training Program. I immediately signed up and became involved with that. My good friend Ari Ruzicki had started the practice in San Francisco called A Gentle Rest. I reached out to him and said, can I come along with you and see what's happening? I went out on that first day and I knew immediately that this was my calling, to be able to help people in homes release their animal companions. And so I've been doing that work now for 4 years. I've probably released maybe 2,500 animal companions. My work has gone deeper as I evolved. I've learned to create ritual and ceremony. I do storytelling and I create music. Each animal has a love song. After taking the doula class, they then asked me to be their veterinary facilitator. So I've been teaching there for the last 4 years. I meet some amazing people that really want to learn about death and dying. And it's something in our society that we really don't deal very well with. Before the modern era, we did understand death, dying, had rituals around it. Then all of a sudden we're dying in hospitals and animals started dying in hospitals on metal tables. There's now a movement back towards the home. My dad died about a decade ago in hospice at home. When your own father dies, it's a very personal experience. And I can tell you that it was probably the most powerful moment for me as a human to be there for his last breath, surrounded with love. And that's what I try to do with our animal companions, to allow people to be surrounding them with love and be there for that last breath.
I heard you say in an interview, I believe, that our animal companions are one of the last vestiges of nature in our lives. Even at the end of their life, the last lesson that they're teaching us is about endings and about death. What exactly do they teach us about death that we're so often afraid to talk about?
Our animal companions are the last part of nature that lives in our urban lives in apartments. Animals are the true essence of nature. And so when we come to the end of life, it's my belief and my experience that our animal companions are teaching us that it's about humane endings and release. It teaches us to be present when an animal has its last breath. And that is something that many of us have not experienced. I hope that we all can be surrounded with love at home when we take our last breath. And that's something for all of us to strive towards.
Given the shorter lifespan of many animals compared to humans, usually people outlive their animal companions. What are some ways we can prepare for an eventual goodbye before our companion's quality of life diminishes, especially as the animal gets older or becomes terminally ill?
Just like in the human world where we have advanced directives, I think it's imperative that we start to think in that way as well. How do we want to see our animals be released? In our modern world, our animals are part of our lives and they live with us. So it's really up to us as pet parents to have a process. Almost all veterinarians that work in practice are already doing this sacred work. They do most of the euthanasias. They help animals at the end of their life and they are guiding their clients. I think that it's important that we as professionals try to just start educating our clients about what is the process. I think only 20% of veterinary websites even talk about the death process. And so that's one small way that we could help educate our clients in simple terms what it really means to be euthanized and what the process is. I think veterinarians are afraid to talk about death. It seems like a failure sometimes. And just like in human world, we push our humans and we push our animals way too far. It's important for us to realize where is that line? And that's sort of what I do, guide people through quality of life issues.
That brings me to my next question, which is how families can recognize when it's time, when the most loving act is letting go. Are there any physical, behavioral, or quality of life signs that indicate an animal's discomfort outweigh their joy?
Yeah, outweighing the joy. I think that's really one way to look at it. There are a lot of what we call quality of life scales that are out there now. I have them on my website. One of them is appetite. It isn't always diminished at the end of life, but a lot of times it is. Activity. Are they able to get around and enjoy life, go for walks or jump onto the bed? Are they vomiting and having diarrhea? These are just common things. We see dementia in animals. Are they staring into the wall, getting caught, not able to do things? Are they able to sleep at night? Are they restful? Able to enjoy the things that they normally enjoyed. These are all things that we discuss as veterinarians with our clients. Death doulas do the same. You can have a calendar and say, is this a good day or a bad day? And start seeing, are there more bad days than good days? It's really probably one of the hardest things for us humans to release our animal companions. None of us want them to suffer. And we have to look at, are we doing something for us and for our emotions? Or are we doing it for the animals? When we start to realize we want to do what's best for the animals, then we can all start to make decisions that are proper. I always tell my clients, have a plan A, B, and C. And it's okay. Whatever happens, you just want to make sure you're doing what's best for the animals.
I want to talk about what an in-home euthanasia with a death doula looks like. But first, I'd like to talk about the process of euthanasia itself. Some people are afraid of euthanasia because they don't know what actually happens.
Typically, the client has been involved with their own private veterinarian, and so they've gone through the quality of life, and they've made a decision that euthanasia is going to be the best, so they'll make an appointment with an in-home euthanasia vet. Sometimes end of life happens quickly on the day of. You don't know it until that day. Sometimes you can have some time in advance with certain illnesses. As a death doula, I do a lot of storytelling, and so I sit down with the client, tell them in advance what's going to happen. Some people just want to be quiet and that's all they want. But I find that most people really appreciate me asking them about the entire life story of their pet. How do they meet? How did they get their name? What nicknames do they have? Are they a foodie? Have they ever run away? Have they been dressed up for Halloween? Do they have a best buddy? All these things. A lot of people tell me no one's ever asked about that. And I take that from the human world where everyone has a story and deathbed stories are very powerful. And then when we're ready, we're going to give them an injection of a strong sedative. And that has multiple drugs. It has pain control drugs like opioids. It has anesthetic and other sedatives. And it's typically given under the skin like a vaccine, back of the neck or along the spine. And if the animal is still eating, which some are, then I always encourage them to have their favorite treats handy so that they can be distracted and given pleasure as I give that injection. And it takes about 5 to 10 minutes to go into a deep sleep. After they're completely anesthetized, then the next step is I'll tickle their toe to see if there's any reflex. And if there's no reflex, that means they're ready for the next medicine. That's a stronger drug that goes into the bloodstream. For dogs, I'll usually use the front leg, put on a tourniquet, shave some fur. Cats can be similar, or there could be other ways as long as you get in the bloodstream. And that's quicker. That only takes several minutes, usually 2 or 3 minutes for the heart and breathing to stop as we release their spirit. Then in my practice, I ask if it's okay, I would like to do a little ceremonial ritual to acknowledge them in your life. Most people, I'd say 95%, are appreciative of that. I'll ring some bells. I repeat the life story. I use sandalwood or sage. I read a poem, and I'll give them each a rose quartz heart. And then I close the ceremony. After that, I encourage them to have some private time with their beloved. And I'll leave the house, typically go back to the car. This is when the other animals in the family can be part of the process, because I do believe that they have their own grieving. They understand death differently than us, of course, through energy and through scent. So this is one way of at least having some closure in their world. Then what I do is I come back in with a blanket or a basket. I wrap them in a shroud, put them on a stretcher, and we carry them back to the car where we can say a final goodbye. And then what I do in my practice, I create an obituary poem for them. And then I also create that into a song. People find that really soothing, that they can have that remembrance of what this animal really means to them. Our animal companions are with us 24/7. They've been through divorces or births or job changes. And so they're really pure medicine. They help us in ways that we can't even explain to other people.
Most of the euthanasias you perform as a death doula are in somebody's home. Can people choose a different location that's special for their animal?
Absolutely. I've done many euthanasias out in their favorite park. In San Francisco, I've done many on the beach. I try to listen to the client, what they prefer.
For a euthanasia that takes place in a veterinary hospital, whether that's planned or an emergency situation, what can be done to make that experience more sacred?
A lot of clinics now are starting to create comfort rooms or chapels. I think that we're all doing sympathy cards. That's one way of acknowledging the sacredness of the loss. What I hope to see in the veterinary world is that each practice would designate a team or one person to be what I call the end-of-life navigator. We'll see that more and more, because I think that the end-of-life appointment is probably the most important appointment that a client's ever going to make. It's up to us as veterinary professionals to make sure that it's a good experience and not rushed, and acknowledge what these animals mean for people.
I've been blessed that I've been able to share my life with beloved companions, dogs, cats, other animals. The loss of them impacted me profoundly. They were some of the biggest loves of my life. Some people are very afraid of witnessing their animal dying. What would you say to them to give them that courage to be there in those last important moments?
Some clients have fears. It's okay. When there's someone that says, well, I don't really want to be there, I'm not sure. When I bring in storytelling and start to bring in this love story, I say, that's the true essence of this relationship. And you won't have grief if you didn't have that love story. I'd say most times, then all of a sudden they say, oh no, I want to be here. And I've had some clients that I come to their home, we go through that process, and they just have to leave the room when the animal dies.
Do you have any suggestions for people to process that grief and move through it versus getting stuck in it?
One thing I always tell my clients when I'm finishing the euthanasia, I explain that your house is going to be so empty. This has been my experience with my own animal losses. And I recommend highly that you go out into nature and do a walk, go to the beach, do something that allows you to break through this initial moment. Grief is something that goes up and down. It's like a wave. I know from my own self, I sometimes cry for days. I don't think there's anything wrong with crying. In fact, I tell parents, show your emotions, because this is truth. You don't need to hide that. A lot of people have more pictures of their pets on their phones than anything. Go through them, create stories, write a letter to your pet thanking them. There's so many grief options. There's books on pet loss. There's Facebook groups for pet loss. There's counseling workshops or support groups. I put that all on my website. I also offer them, my own clients, if they need to talk to me later, I'm available. I'm there as their guide if need be.
We've talked about what people facing their companion animal's death go through, but veterinarians are also impacted by euthanasia. It's apparently one of the leading sources of anxiety and depression in the profession. How can veterinarians and their staff protect their own mental health while providing compassionate care?
Yeah. One of the biggest issues within the veterinary profession is anxiety, compassion fatigue. It's unfortunate that our profession has one of the highest suicide rates as well. As a profession, we're trying to support each other. We have online groups. Not One More Vet on Facebook was founded by one of my colleagues in San Francisco. What I suggest for all clinics, if you can, is to have death rounds. Have a time each week or once a month that you can talk about these experiences so that you can normalize it and support each other. Because I think that we veterinarians have one way of understanding death, but our technicians and our staff aren't trained in the same way we are. And of course, there's the clients. We, of course, want to support them as best we can. We're not therapists, so we can't take on that role. But surely if someone is really struggling, we can guide them to a therapist.
What has death taught you about how to live?
One thing that loss of my animal companions have taught me is that endings are continuing to happen in our lives. And it's really how we react to them that makes us better humans for ourselves, but also as role models for others. Planning for our own ending, having advanced directives. Do you want to be on a feeding tube and a trach tube for your last months? I know I don't. Thinking about your animals. How would you like to see their last day? I hear these stories all the time. They're giving them their favorite treats. They're just getting everything they could ever imagine. They're taking them for their favorite walks or going to the beach. People are carrying them in carts. I have clients that will take their dog on walks around the block for weeks just in the car because they know the dog is still enjoying that fresh air. Other clients have had going away parties, just like humans do. You can invite all the people that have ever loved this animal to come and say their goodbyes. I think it's really important that we help our children with death and dying. We're having our own deaths all the time, letting go of things and different phases of our life. I think that we can all be better at it and teach each other. And I always would tell you, make sure you just share your losses with people that understand so that you don't get sidetracked by ignorance.
Would you please share with people how they can learn more about your work and where they can find you online?
The best place is just to go to my website, belovedfarewell.com. It has my contact information. I'm an artist, and so you can check my art at kengorczyca.com. Yeah, feel free to reach out if you have questions.
Thank you for having taken the time today.
Thank you so much for this time.